Okay, the last personality disorder of the cluster C is dependent personality disorder. Now, dependent personality disorder is one of the most often diagnosed personality disorders. It's someone who is passive, someone who's submissive, someone who puts other needs above their own. They also have a tremendous fear of being abandoned, which is very similar to the borderline personality disorder. In fact, those two characteristics are the same, except the difference with dependent personality is that those individuals have tremendous fear and anxiety when they feel that abandonment, whereas with a borderline, it causes them to be angry. So that's the difference between the two as far as that one characteristic. Dependent personality types also have a difficult time making decisions. They rely on other people for affirmation, for approval, and also to care for them. They have a hard time making good choices and have a lot of self-doubt. Dependent personalities have low self-esteem and low self-confidence. They have a hard time confronting conflict and dealing with situations that are confrontational in nature. Maybe you know someone that has a dependent personality type. Those individuals rely excessively on others for praise, for approval, for acceptance, and even for decision making. Now, as I've said all along with personality disorders, it's multifactorial, meaning that there's a biological component to it, there's a social component to it, there's a psychological component to it, and there's an environmental component to it. Many factors can contribute to this disorder developing in an individual. Sometimes parents that are overprotective can contribute to the development of a dependent personality, or a parent who is very authoritarian, very strict. That can also cause this type of personality disorder. So what do you do? What do you do if you have this? Well, one thing is to work on being more independent, being more self-confident, increasing your self-esteem, and making decisions independently of others. So I would suggest that you start out by make a list. Make a list of your positive traits, your positive attributes. And every day, read that list. Maybe there's 10 items. I am intelligent. I am hardworking. Whatever it might be, write it on index cards. And when you wake up in the morning, you read those cards, focusing on the good in you. And at nighttime, before you go to bed, you read the cards again. So when you awaken and when you retire at the end of the day, you're focused on the good in you. Because a lot of people that have dependent personality don't recognize the good in themselves, and they rely on others to identify the good in them. Another thing that can be helpful for this type of personality is changing the way you think. Remember, I've talked about cognitive behavioral therapy? So part of the cognitive section of this is changing your distorted perceptions, primarily of yourself. Dependent personality types are hypersensitive and hypercritical of themselves. So limiting or eliminating the negative self-talk that people generate in their head. Also, it's very helpful for this personality type to learn to be assertive, to be direct, to be able to express their thoughts and feelings in a direct manner. And lastly, to have some experiences that give them a sense of accomplishment, achievement, fulfillment, to build on that so they can build not only confidence but momentum and feel that they can rely on themselves and trust in their own abilities. So those are some solutions, some strategies that people can implement. Now this is the last of the cluster C personalities. I had done cluster B, cluster C, and then there are 3 cluster A. The cluster A's are not as common, and I'm not going to be going through each of those cluster A personality types. So next week I'm going to discuss a completely different area. And I appreciate your support, appreciate you viewing some of my new vlogs, and thank you. And be well, and remember, tune in next week for some new material. Until next time, Dr. Tony Ferretti.